Hello, this is Dr. Behnam. I'm a board-certified dermatologist, laser and skin cancer specialist. Welcome to our educational video. Today we're going to talk about cold sores. Cold sores are caused by a virus, which is actually herpes virus. And the way that patients get cold sore, it is transmission of basically saliva from one person to another person. Most people actually in the United States, over 65-70% of all people in the US have cold sores. The fact that a lot of them are not walking around with something with a blister around their mouth is because most of the time the cold sore is just sitting there. The herpes virus just sits in the nerves and doesn't do anything. At times of stress, basically it could come out. So, first of all, what are the most common ways of preventing an occurrence of a cold sore? The most important thing is to wear sunscreen around the lip area. If you're going to be out in the sun for a whole day and you have a history of cold sores or herpes around the mouth, the sun will cause the sore to come out. So wearing a lot of sunscreen basically will prevent a flare-up. Also have patients that, for example, they undergo surgeries or are under a lot of stressful situation, and stress basically will allow the virus to proliferate and basically form a sore around the mouth. So how does a cold sore look like? So cold sores, first are typically painful and they're tingling. So patients describe this tingling sensation a couple days prior to the lesions coming out. It is tender to touch. They're typically the group of clusters of vesicles basically at the angles of the mouth. We could also get it on the upper and lower lips as well. And then basically they crust over. The first initial of cold sores could be very severe, and they could include lesions inside the mouth as well. How do we treat it? The most important thing is to actually start taking an oral medication called acyclovir, or its brand name called Valtrex, literally immediately as soon as you feel this cold sore basically coming on. With Valtrex, I typically prescribe 2 grams. You take it in the morning and 2 grams you take it at night and you're done. The sooner you take it, the faster it's going to heal, and the less visible it's going to be because you're not going to have the crusted lesions around the mouth for like 10 days. Again, this is Dr. Behnam. I'm a board-certified dermatologist. Thank you for basically viewing our video. If you have any questions, feel free to give us a call at 310-315-4989 or visit our website for other educational videos, santamonicaskin.com. Have a nice day.